Our group's research focuses for this project are literacy rate versus alcohol consumption per capita, as well as literacy rate versus smoking prevalence in Russia and Brazil. The variables are literacy rates, which include the percentage of people ages 15 and above who can, with understanding, read and write a short, simple statement in their everyday lives. While alcohol consumption is an estimated consumption of alcohol in liters for average adults aged 15 years and above per capita. And smoking prevalence shows men and women who are occasional and daily smokers in the year. Here we have a weak positive correlation in the years from 1996 until 2008 in the literacy rate versus alcohol consumption graph for Russia, and a negative correlation in Brazil as alcohol consumption goes down as literacy rates go up. Focusing on Russia, the trend suggests that alcohol consumption goes up as the literacy rate goes up. The literacy rate in Russia in the period from 1996 to 2008 is between 98% and 100%, which is incredibly high. That is thought to be due to the revolution, as the people had incentives to learn and take action, but it continued well on to 2011, where figures showed that 94% of 25 to 64-year-olds hold at least an upper secondary qualification, while the OECD average is 75% and the G20 countries' average is 60%. Interestingly, as the literacy rate rose, the alcohol consumption rate rose as well, placing Russia as the fourth highest volume consumer in Europe, with an annual per capita consumption of about 15.76 liters. Alcoholism has always been an issue in Russia. It was believed to have started partly as a coping mechanism during Tsarist times. It is also most prevalent amongst working-age men. And since during the early 1900s, adult mortality rates rose in most post-communist European countries, it could be suggested that the stress of mass privatization led to excess consumption of alcohol, therefore leading to early death. Another study suggests that Russia's transition to capitalism and democracy was not as lethal as commonly suggested, and that there were several factors affecting it, such as the anti-alcohol campaign, which simultaneously raised the cost of drinking and subsidized substitute activity, causing a marked fall in alcohol consumption, and consequently crude death rate fell by an average of 24% per year. However, the campaign's unpopularity and public finance impact led to its repeal shortly before the collapse of the Soviet Union. The Russian death rate subsequently climbed rapidly. Data limitations prevent a definitive answer to the link between alcohol consumption, death rates, and literacy amongst the Russian population, but we believe it is due to a long-lasting habit encouraged further by outside stressors. While in Brazil, the graph shows a decrease in alcohol consumption while the literacy rate rises, which is most likely due to neighborhood social deprivation. A team of researchers found that alcohol abuse and regular use were found in areas where neighborhoods show social disadvantage. This explains the initial trend of the graph, but in the year 2005 the trend changed as it went up and continued to rise. This can be explained according to the World Health Organization as there was an increased consumption of alcohol in Brazil by higher social classes, as an underage drinker coming from a wealthy background in Brazil has a lower perception of punishment since they can work around the drinking laws of Brazil. Another factor is the working population. Employees who receive a salary higher than the minimum wage in Brazil tend to use it for alcohol. Therefore, the higher the income, the higher the alcohol consumption. As for literacy rate versus smoking prevalence, there was a negative correlation found in both Russia and Brazil for the years 2000 to 2014. The trend in Russia showed that smoking prevalence decreases in men and remains constant in women, while having little change in the literacy rate for both genders. As mentioned earlier, Russia holds a high literacy rate of more than 98% in both men and women throughout 2000 to 2014, due to the enrichment of the educational system. Therefore, there must be other driving forces for the drop in male smoking prevalence. One big factor might be reinforcement in regulation. Vladimir Putin, the Russian president, had a concern on the declining public health level, partly due to smoking. Therefore, promoted policies of restricting smoking. In 2001, smoking was prohibited in public areas such as workplaces, hospitals, and educational institutions. In 2006, advertisement of tobacco and smoking articles was restricted on major press media, including television, radio, and newspaper. In 2008, Russia joined Framework Convention on Tobacco Control, which was effectuated by the WHO. Later on, a law aiming for a total smoking ban was established in 2013. Smoking in any place excluding private property was prohibited, along with further restrictions being imposed on promotions and sales of tobacco products. Another factor is a financial one, as the economic crisis and recession in 1998 caused a decrease in salary level. On the other hand, the price of tobacco had risen due to the rise of its tax. As a result, tobacco sales went down. As for Brazil, the graph shows a decrease in smoking prevalence in men and women as literacy rates go up for both genders. Smoking prevalence is decreasing because Brazil has been at the forefront of global tobacco control initiatives for the past 2 decades. With changes in tax policies and licensing systems in the past, they have been one of the most successful countries in terms of decreasing tobacco use. In conclusion, we do not have definitive proof to support our claims of the reasons that shifted the graph, but have mentioned the most likely causes based on our research.